Aloha, Dr. Fauci.
Aloha.
Thank you so much for spending a little time with us. I have to say, we are so honored to have you on. I know you're probably the busiest person on the planet. You hear that too often. But we in Hawaii just appreciate you and appreciate the opportunity to hear right from really our best voice on COVID, what we can expect with this disease. So again, we're grateful to have you. And if it's okay, may I say a little bit about your past so our viewers understand the expertise that we're lucky to have today?
Sure. Go right ahead.
Okay, so before we dive into the many questions that our constituents across the state of Hawaii have, people should know that Dr. Fauci, you are a leading immunologist in the country. You run the National Institute of Allergy and Infectious Diseases. You were a leader in AIDS research going back. I'm not sure anyone's published more than you that I can tell. You have received so many awards, it would be almost indiscreet to mention them all, but the Medal of Freedom does come to mind. 30 honorary degrees. I mean, we just so appreciate you and your service under 6 presidents. So our viewers know that you are really the best person to talk to about COVID. So again, for this time today, we are infinitely grateful. And we can only assume you're even more proud of your 3 daughters than all of those achievements.
I am indeed.
I'm sure of it. I think you and my mom were in school together too, which is kind of a neat thing. So lots of connections in this world. But thank you again for this time. Would it be okay if I dived into questions?
Please go right ahead, sir.
Okay. So I'm a physician, work here in Hawaii as lieutenant governor, and we are wrestling with COVID like the rest of the world is. We watch you every day. First question that our people wanted me to ask was, from your perspective, how do you believe America has done so far? What did we get wrong and what are we doing right? Where do we go from here on COVID?
Well, I mean, obviously there are parts of the country right now that are doing well, but if you look at the big picture, you don't like to say wrong, right, well, bad, but you just have to look at the numbers and realize what the numbers are telling you. We're a very large country indeed. By other people's ratings, we were very well prepared prior to the onset of COVID-19. But as it played out, we got hit worse than any other country in the world. We have now 210,000 deaths. We have 7+ million cases. And if you look right now where we are today, despite the fact when you look at the map, you see there are some areas that are doing very well. Hawaii was one of them that actually handled it very well. Other parts of the country got hit, and then when they came down, they handled it well subsequently. But if you look at where we are right now, we're stuck at 40,000 new infections each day. That is what I call a baseline level that we need to get much, much lower than that. And the reason I say that is that in and of itself, it inherently is too high. We need to get down way below 10,000, because when you're that high, there's so much community spread that the standard ways of identification, isolation, and contact tracing don't work very well, particularly when you have that level of community spread. We know that a substantial proportion of the people are infected and have no symptoms, but they are spreading it to people who are vulnerable and people who will require hospitalization and will require intensive care. So it's a very complicated issue where it looks to some like it's not so bad. But if you're one of the individuals who's in the vulnerable group, the elderly, those with underlying conditions, it's a very serious situation. So you can't almost describe how we're doing and how we've done with one single sentence. It's a complicated issue because we're a big country that's very heterogeneous. One of my big concerns for most of the country, because of the climate, which Hawaii, as you know better than I do, is an outlier vis-a-vis, paradise 365 days a year. But in many parts of the country, as you get into the fall and winter colder weather, which will drive people indoors more than out, then you have a problem with a respiratory disease that it might even get worse, which is the reason why I want to get that baseline level as low as we possibly can and not have it stuck at 40,000 per day.
We've seen those numbers. We obviously are thinking about them. I'm going to ask you in a few moments about what it will look like as we begin to open travel for the state of Hawaii, which we're scheduled to do in 8 days with a pre-test. But first, I wanted to say, you mentioned the prevalence or the percentage of people that are asymptomatic. People ask that all the time. What percent of people are felt to be asymptomatic carriers of COVID?
Yeah, it is estimated that between 40 and 45% of the people who are infected do not have symptoms. That is a substantial proportion, particularly when you do the modeling. You can estimate that, again, a substantial proportion of the infections that occur are from an asymptomatic infected person to an uninfected person. So if that large a percentage is asymptomatic, you have a big problem in identifying when you have community spread about who is spreading the infection around.
I just got over COVID about a week ago. I caught it from one of my colleagues in a car, and he had a mild cough, didn't know he had COVID. We were masked, actually, except for when we were sipping our coffee, and we were able to determine ultimately that's how I caught it from him. And like you described, I was lucky enough to be in the age group and not to have any underlying medical conditions that put me in a high risk. So I had 2 bad days of symptoms, and then I got better. But I can't say that for all. I mean, I've seen some terrible suffering in the hospital too. I wanted to ask you also about that floor. You said we're at 40,000 cases in America, and we've had kind of this steady number. What do you think the best tools will be to knock us down underneath that floor? What are your thoughts?
Well, it really is simple. I've said it 1,000 times, but thank you for giving me the opportunity to say it again to your folks. Simple public health measures that we know work. Wearing masks uniformly, keeping distance, 6 feet rule, avoiding crowds, doing things outdoors much more preferentially than indoors, such as outdoor dining as opposed to congregating in a closed restaurant, and washing your hands frequently. So if we do those 5 things, we know from a number of studies, you will prevent surges and you'll be able to get in a situation where you don't have a large amount of community spread. We know that. I mean, it's been proven.
Thank you for that. I try to preach that a lot, and then we end up getting into all these other conversations about testing this, testing that. And I want to ask you about testing a little bit. But in Hawaii, I can give you some numbers, and you can maybe reflect on whether it's going to work for us. Big Island has had a mask wearing rate of 57%. The island of Kauai, county of Kauai, 68%, Maui, 70%, and Oahu, 84%. And we've seen spread in different ways. What do we have to do? What percentage is there is there an analytical way for us to look at how much mask wearing we really need to stop the spread?
I can't give you a number because that model has been worked out, but I think that you would be able to even do your own experiment, like the difference between the Big Island and Oahu. What was the difference in those 2 islands in the rate of infection, the percentage of the population that got infected, the test positivity? You could tell it right there by looking at your own data.
Yeah, and we've had clusters too. We've had outbreaks. Our Pacific Islander community got hit really hard. A lot of them live in multi-generational households. How would you address that? We have some economic disparity in our state, as you can imagine, like everywhere. And then our Pacific Islander community, where we were having very high positivity rates for a time, over 50% for 1 week in a part of our state. We had people living in groups of 22 people in a single household. Is there any way to stop spread when you have circumstances like that?
That becomes really very, very difficult. And that I could almost feel how frustrating that must be, because you're not going to change the way people have lived for forever, a traditional way that families and communities live. So the best thing that you can do is to try and prevent the community spread to get high enough that would make those, multi-generational 20 plus members in a single household you don't want to just throw them out of the house. I mean, they've got to live the way they're going to live. So you really want to try as best you can to keep the infection away. It's almost like protecting the vulnerable. And I would imagine that there would be a substantial proportion of the people in that multi-generational home that are in the elderly class and are having underlying comorbidities. I mean, it almost has to be by statistics alone, because you're going to have grandma and grandpa and maybe even great grandma and great grandpa in that home.
Yes, you're completely right. What we've done is we've tried, of course, traditional health education, a lot of mask wearing, and we've begun to apply some other separation rules, giving people, if they're positive, a place to do respite, especially other isolation mechanisms, like giving people hotel rooms if they need it. But it's hard because you don't want to, like you say, disrupt traditions, but we want people to be safe. We've had so many questions, I don't even know where to go. Latest science on how coronavirus spreads. A lot of people still want to hear that. Is it droplets? Is it airborne? Do you have the latest guidance for us?
Yeah. Well, certainly it's respiratory droplets. We know that about any respiratory disease. But recent data is making it much, much clearer that there is a degree of aerosol spread. So let me explain exactly what aerosol spread is so people understand, because I think there's a lot of misperception about that. So in a general respiratory illness, when you speak, certainly when you cough and sneeze, but put that aside because, as I said, most people are not coughing and sneezing. Most people who are spreading it are speaking the way I'm speaking. So when I speak, even though you don't see anything, when you do light refraction, there are droplets that come out with speaking, singing, and certainly with coughing and sneezing. If they're above a certain size, they generally, by the weight and the velocity of how quick they're coming out, they go down before you get to 6 feet. That's the 6 feet rule. However, when you say aerosol, that means that these respiratory particles, they don't immediately go to the ground. They have the capability of floating around anywhere from many seconds to minutes, or maybe even longer, which means that being just 6 feet away isn't necessarily the total protection. You've got to wear a mask, number one, and you've got to remember that if you're indoors, it is much more difficult to escape infection when there's aerosol spread because it continues to recirculate. If I'm in this room and there's no really good circulation in and out, you can have that droplet that go around for several minutes. So just being 6 feet apart is not going to help you. And there's been demonstrations of people in restaurants who are sitting way distance from somebody on the other end of the restaurant. One person is infected, and then you wind up, this person who never came near that person winds up getting infected, which tells you, underscores the two things that I've been telling you. One, wear a mask. Number two, outdoors always better than indoors. And if you're going to be indoors, keep the windows open. I would imagine, as I hear from all of the people, because I speak to representatives of states throughout our great United States, it's much easier to keep a window open in Hawaii than it is in Minnesota in November or December.
Yes, you're so right. And we've begun to do that. So when we opened our restaurants, we're telling them open air is better. I even read a study somewhere, I think it was out of Japan, where they felt that indoor dining was 19 times more risky for spread than outdoor dining. I don't know about those numbers, but I think it reflects your point. It underscores your point. You were talking about spread, right? What about outdoor activities like beaches? What kind of risk would you assess? We have a lot of that here. That's the recreation of choice, being out in the water, being at the beach. Do we have risk when our families and friends are together on the beaches?
You know, it's much less of a risk, but it is a risk if you are congregating in a way where for prolonged periods of time, you're really close together. So you really have to strike a delicate balance. So I'm not saying this is perfect, but it's one of those things. If you could separate into almost like pods of people that you know are being careful. Maybe people who've been tested, you know, they're negative, you know, they're not being reckless.
Yes.
And stay with them, but not all over them. You know, you could be separated by a fair amount. Obviously, you not want to be wearing a mask when you jump in the water, you know, but swim around, have fun. But when you come out, when you're congregating, put a mask on in that respect. So you don't want to tell people not to go to the beaches, because the beaches may be a safe place. The wind is going to blow all things away. You don't have to worry about things hanging around and droplets. So it's something you probably should enjoy with a little care. That's all.
That's so eloquently said. And the rule, just so you know, what we've done is we've limited our numbers to 5 people together at the beaches. And we've asked that people try to be in their family unit or their household unit, because of course that's their bubble or their cohort. And we're being careful. We did see a spike up to, these numbers sound low, but for a small state, up to about 300 people per day were positive. As you know, in May, we had nobody. We had 30 cases in 32 days. We started to open up and our cases went up. We had 6,000 cases in August and our hospitals started to fill, never overflowed. And now it's come back down to 98 per day with some good rules. But the rules are kind of a reflection of what you've been expressing. Can I switch the topic a little bit to testing,
Sure.
Dr. Fauci? Is that okay? Okay, so what's the best recommendation on testing overall? We have limited tests in Hawaii, just so you know. We have about 4,000 tests available to us per day for our 1.4 million people. We tend to do about 2,000 tests, but we're about to have some added pressure as we begin to have travelers come back to Hawaii. We have proposed, and I'll talk a little more about this, on October 15th, if travelers get a pre-test 3 days before, 72 hours before their departure, they will not have to quarantine here. But we have some finite number of tests. Who should we be testing first and foremost? Should we test everybody? Should we be testing people with symptoms? What's the recommendation?
Well, this is one of those areas that's really very confusing to people, because there's an issue of, should everyone who needs a test get a test? Yes. Should everyone who wants a test get a test right now? Not necessarily. Hopefully, when you could flood the system with a 5-minute point of care little dipstick that you could stick in your mouth, go bingo, and no, I mean, we'll ultimately get there. We're not there yet. So I look at testing in kind of 2 separate buckets, let's call it. One is when you absolutely need to know if a person is infected because they have been exposed to an infected person and or they're symptomatic and being exposed. So you test them. You use a sensitive test that generally takes at best 24 to 48 hours. And sometimes if you don't have the right flow, as it were, it may even take longer, which complicates it, because if you take a test that requires 5 days to come back, it's like, it's not helping you with contact tracing. Then there's a thing called surveillance, of trying to determine what the level of infection is in your community. And that's when you do a test that isn't as sensitive as the PCR test, which 97, 98% tells you whether you're positive or not, but more or less does screening. And this is what you do when you bring back in the mainland, as it were, when you get people who might be wanting to go back to college. A lot of the colleges are essentially testing everybody who's coming in, and then maybe twice a week sampling them, so they'll know, at least from square one, we're going to make sure you're all negative. And then as we go by, weeks go by, we're going to intermittently sample. The sensitivity of that test isn't as good as I need to know if I'm infected because I was exposed and I'm symptomatic. It's more, hey, I want to go to school and I would like to get in there, so do a kind of surveillance testing. So that's the other kind of testing. Then there's the testing of, I've not been exposed, I have no reason to believe I'm infected, but I need to get into some place that I want to make sure that I'm not bringing infection in there. That's when you, and I think that's building up the question that is on your lips, ready to come out, is what is the sensitivity of those tests usually? And if it's negative 1 day ago, 2 days ago, 3 days ago, how sure are you that when you get to the place you want to be, that you're still negative, that you haven't been exposed? And that is a question that doesn't have a good answer. So one of the things that we do here that might help you to think this out is that when you go into the White House, like I do frequently, you have to get tested right there. It's a 15-minute test. That's the good news. The somewhat sobering news is that it's not a 100% sensitive test. So it's easy to screen the 50 people that want to go into the White House, but you know that it has about a 20% lack of sensitivity. It's only 85%. So you have the advantage of screening all these people quickly, because if you had to wait a day and a half of a really sensitive test, you'd have a line trying to get in there that would never work. So you sacrifice sensitivity for the ability to do it. So I know what you're getting to is that you're faced with, you're trying to open up the islands. You don't want to get another surge of cases because you've done so well in putting the lid on where you are. So you have the people who are there saying, we don't want to reinsert COVID into where we live. On the other hand, if we don't open up, the economy is going to crash even more than it's crashing. Is that your dilemma, so that we know we're talking about the same?
That is. You're practically a Hawaii resident, Dr. Fauci, in your wisdom on what we're dealing with. That's exactly right. So we're going to have a test, nucleic acid amplification test, 72 hours prior to departure, and then we're talking about what to do after. And the mayors where we've had counties with very low rates of COVID, and they also have very little health care available in our rural communities where I was a national health corps guy. I worked in the neighbor islands, still do the ER shifts over in the countryside. They have so little health care, sometimes some capacity, that they're worried about a spread, or they're worried even about when we open up to provide services for visitors, that of course there'll be a lot more people mingling at work and they'll see spread. So they would like to see a second test. What I recommended was some strategic surveillance, much like what you recommended. So we just make sure 4 days after they've had a negative test from New York or Boston or DC or LA, they come to Hawaii, and instead of using 8,000 tests to test everybody again, which is actually 100% more than the tests we have per day, we do some strategic surveillance. Also, we test maybe the college kids coming back a little extra, and we test our high-risk groups. What do you think about that? I've recommended that we use our limited testing on our people that are at higher risk, like our first responders, people coming back from college, people that work at nursing homes. Would that be adequate, do you think?
Yeah. I'm not going to be able to give you a definitive answer, because let me say something that's reality. The reality is, no matter what you do, there are going to be infected people who slip through the cracks. It's inevitable. It's going to happen. The critical issue is that since you have such a low level of infection right now, that you should be able to handle that and prevent that from blipping up. I mean, you've got to be able to prevent that from happening. If you do that, you can accept that you're going to have some time or other after you open up, regardless of what you do, there's going to be some people who are infected. So number one, be prepared to be able to get all over that. Prevent it by the 5 things I keep talking about, but also the wearing of the mask, et cetera. So now you're asking me, should we stick with one thing, the 72 hours before you get on a plane and come, and do nothing else? Or should we get the 72 hours and have a 14-day quarantine? So a 14-day quarantine in a location that depends on tourism is a real tough one, because most people have 2 weeks of vacation They don't want to spend it locked up in a hotel, no matter how beautiful the hotel is. So what I would do is I would do something, but it doesn't necessarily mean 14 days. In other words, I can understand the anxiety of people on the island saying, you know, if you just do a test 72 hours earlier and that's all you do, that's not going to be enough. I mean, you're just anxious. But again, you don't want to go and quarantine everybody. That would hurt the tourism business. But you mentioned 2 or 3 things that are worthwhile. You can either get the really cheap, rapid, not that sensitive test and test everybody that comes through quickly, bango, and not like a really expensive, total amplification PCR. You're not going to get everybody, but statistically, you're going to dramatically diminish the likelihood that an infected person enters. Or you can do what you suggest, surveillance. Don't test everybody, but pick out representative ones to see what's coming into the country, and special attention to people that might have been at greater risk, like college students coming back from hot areas.
And we're right on that. And we're coming so fast to the end. They will shoot me here if I don't get to ask you a little bit about vaccines. Dr. Fauci, what can we expect as far as a vaccine towards the end of this year, next year? Can you give us a brief update on where we are as a nation on vaccines so that we can add that level of protection?
Yeah, I think we're in a reasonably good place. And let me explain that the United States government has made major investments in 6 vaccine candidates, 5 of which are already in advanced phase 3 trial, 2 of which actually started in advanced phase 3 trial. When I say advanced, I mean one candidate has 30,000 people in the trial, one has 44,000, one has 60,000 people. The projection is, given the level of infection that we have and given the location of the sites that are doing the testing, that we will have and know whether or not we have a safe and effective vaccine by November or December. We may know earlier. It could be October. Quite frankly, I don't think it'll be. I think that's unlikely, but I think it's quite likely that we'll know by November and December. If we have a safe and effective vaccine, which there's never a guarantee, but I'm cautiously optimistic that we will, already we're making doses in anticipation of success, even though there's no guarantee of success. So that by the time we get to December, the end of the year, the beginning of January, February, we should be starting able to vaccinate people who are in the high priority group, people like healthcare providers, those who have underlying conditions that make them more susceptible to the deleterious effects of the virus. Then you get into essential personnel in society, and then you get into students, and then you get into the general population.
It's fantastic news. Will it be do you anticipate a 2-shot protocol, vaccine and a booster, or just 1 shot?
No.
Yeah. Okay.
5 out of the 6 candidates are prime and boost, namely 2 shots. One of them will be a 1-shot vaccine, but most of them will be a 2-shot vaccine.
What percentage of the country will have to be vaccinated to make for significant immunity for us?
Well, that depends on the efficacy of the vaccine. So you got 2 factors that are working together. You know, if you get a 95% effective vaccine, which I think may be too much to hope for, but I am a cautiously optimistic person and somebody who generally likes to look at the positive side. I don't think we're going to get that well. I think it'll probably be about 70% effective, but then it's going to depend, as you said, on what percentage of the country gets vaccinated. I would think you really want to strive for 75, 80% of people, but we know that there are so many people who just don't want to get vaccinated, we may not reach that amount. You know, with influenza, we get anywhere from 50 to 60% of the people vaccinated. We really want to get that up to 80, 85%. That would be great.
And we're getting already towards a half hour. I just wanted to one more time. What's the most important thing I can tell my people here in Hawaii to do to prevent COVID from spreading? What's the best advice we give them?
Wear a mask. Yeah, I'm seriously. I mean, that's it. I mean, there's no doubt that that
Yeah.
worked. Wear a mask and try
Okay.
to avoid congregate settings. A whole bunch of people together, some of whom don't have masks, crowded indoors is really bad news.
If we do that, we wear masks religiously. Can we bring tourism back? Can we be safe as Americans and Hawaii residents?
I think you can. You can do it gradually and prudently and carefully, but I think you can do that. I think you could get your economy back, get people getting back to their jobs that are so dependent on people traveling into your state. I think you can do that, but you got to do it prudently and carefully. You can't throw caution to the wind once you open up.
Yeah. We have 11% of our people haven't been able to pay their rent. We have as much as 21% unemployment because we're very dependent on tourism. But we don't want one extra case of COVID. I mean, we lose one person in our heartbreaks. We've had 160 fatalities. So we so appreciate your wisdom. I can't tell you. Is there anything else you want to share with us, Dr. Fauci, about Hawaii or about America and COVID?
No, I think we really covered the major points. And thank you for having me and giving me the opportunity to talk to you and obviously to your citizens through this virtual interaction.
Well, they were really grateful that you could come. So we wish our best to you and your family. And it pains me to say this, but even to your Yankees, I'm going to be a supporter for you because you're our champion here across the country against COVID. So please give our best to everyone who struggles with COVID. And if you ever come to Hawaii, please consider yourself a welcomed and just a hero for us. So thank you again, Dr. Fauci. We respect you.
You're welcome very much. Thank you for having me. Take care. Take care. Stay safe.
You bet.